Butterfly procedure. Perform your 40 to 60 second hand wash. Call your patient, greet them in a friendly manner and tell them your name. Ask for their referral and Medicare card. Once you have looked at what tests the doctor has ordered, ask them if they are happy to continue. For example, your doctor has requested for you to have some blood tests. Is that okay? Once you have gained consent to continue, you need to formally identify your patient. Ask them to please spell their surname. Please spell their first name. What is your date of birth? Can you please tell me your address? What is your best contactable phone number? We need to ensure the Medicare card details match what is on the referral and fill in the Medicare number at the top of the referral if the doctor has not done so. Check that the patient is seeing the doctor that is on the referral and any copy to doctors to ensure all doctors get the results. Ask any questions that are required, any pre-test criteria such as fasting, withholding, or any medication details. List these in the clinical notes section on your referral. You are now ready to start. Sanitize your hands. Apply the tourniquet and palpate for a vein. Once you have selected a vein, loosen your tourniquet and sanitize your hands again. Gather your equipment into your kidney dish. You will need 5 things: tubes, butterfly device, barrel, cotton wool or pozzolan, and lastly, the alcohol swab. Take this straight to your patient and swab the selected site and leave on their wrist. Open the packaging and remove the lid completely so that your butterfly device is resting in the clear casing. Pick up the butterfly device by the tubing end and slide the plastic wrapper off. Find the white base at the end of the tubing and attach the barrel. Ensure the tubing and the clear connector are firmly attached together. Holding the white base of the tubing, run your fingers down the tubing to straighten out any kinks. Rest the device back in the clear packaging bed and apply your gloves. Place the kidney dish within reach and tighten tourniquet. Pick up the butterfly device in your dominant hand by pinching both wings and folding to one side of the needle with your thumb and pointer finger. Remember, the dimple side is for your grip, so make sure you feel them on your fingertips. Otherwise, the bevel will be upside down as well. You can then put the barrel into your palm and hold it there in your pinky, ensuring the tubing is not tangled. Move to stand in front of your patient and in line with the vein. Touch the swab and repalpate if you need. Uncap the needle and anchor your vein. Warn your patient of a sharp sting. Insert the needle. You should see a flash of blood in the yellow chamber of the butterfly device if you are in the vein. With your non-dominant hand, place your finger or thumb on the yellow chamber and release one wing. Flatten this against the arm and release the other. Once both wings are against the arm, gently let go with the other hand. Without holding onto the tubing, place the barrel into your dominant hand using your pistol grip and insert your tubes, making note of order of draw and any purge tubes that are required. You might find it easy to rest your hand on the patient's forearm for stability to change the tubes. Once you have established a good flow of blood, release the tourniquet and check on your patient. Invert your tubes after each have filled. Once all tubes have been taken, take the base of the yellow chamber of the butterfly device between your thumb and pointer finger. Pointer finger at the back and thumb at the front. You will see a flat part designed for this grip. Once you have taken control of the needle, hover the cotton ball or pozzolan over the injury site. Remember, do not put pressure on the needle when it is still in the arm. Exit the needle and press down with the cotton ball or pozzolan, making sure the needle is away from both you and your patient. Ask your patient to apply firm pressure. Without swapping hands, keep hold of the butterfly device in your dominant hand and pull the tubing down with your non-dominant hand. This retracts the needle into the yellow chamber. You will hear a click when it is locked in. Dispose of the needle and the barrel into the biohazard bin. This is the flip top bin. Label your tubes and ask your patient to check the spelling and date of birth. Check the patient has stopped bleeding and apply a dressing. Give aftercare instructions, remove tourniquet, and ask your patient to sign for Medicare and wish them a good day. Tidy up your workstation, complete your referral, barcodes, day sheet, and place your tubes and your referral in your biohazard bag. Remove your gloves and sanitize your hands. Place your bloods in the processing area and wash your hands with soap and water.